We induce by 41 weeks if you are healthy and gone past your due date. And there is evidence to show that after 41 weeks, babies don't really do so well in utero anymore. The placenta, as I tell my patients, if you've seen me within the last 4 weeks for a prenatal visit, you know that I say this: the placenta is a time-stamped organ. It's not meant to work well in perpetuity. It starts to not work well. When a placenta doesn't work well, it's a house of cards. Baby is not perfused very well. Baby starts to not look so great on ultrasounds and on those non-stress tests. If anyone has had one of those tests where we put you on the monitor for about 30 minutes to an hour, they're usually done in our high-risk center here. That's what we're talking about. And so we follow that evidence-based guideline that Stacey was talking about, and we will induce you by 41 weeks. This day may be moved up for you if you have a high-risk pregnancy. Please talk to your provider if you've been, hearing like, hey, you're going to be induced, or hey, you're not going to be going past your due date. Talk to us. But if you're young and healthy and everything's been great, we'll let you go to 41 weeks. How do we get this done? All that ripening, early prodromal stuff that we were talking about that can precede your labor, your true labor, by a couple of weeks, we have to do that for you if we're inducing you, usually. So we have to ripen the cervix. We have to get it soft like the stick of butter. We've got to tip it forward in your pelvis. We've got to get it thinning out. We've got to do all of that stuff. How do we do that? We ripen it. A couple of different ways that we can do that. Cervidil, this is one of the ways that we can do this. This is a Cervidil. This little string, it's a hormone impregnated string. This part is inserted into the cervix where it just kind of works. It's activated by heat, body moisture, cervical and vaginal secretions, and it starts to kind of manually dilate ever so slightly the cervix, but more importantly, thin it out, get it soft and ready. Cytotec is a pill that can be inserted vaginally or can be taken by mouth, and that preference is, kind of you and your midwife at the time. That will also help ripen you. And the cervical Foley bulb. This is a balloon that is inserted into the cervix. It's blown up with some sterile water, and that will help manually stretch you to about 3 to 4-ish centimeters, okay? And then it falls out. Hooray. How long does all of this take? A couple of days. So again, when the movies are like, oh, I was brought in and I was induced at 5 a.m. and then I had a baby by 5 p.m. I mean, if you blow the curve, that's great. We love that. That would be wonderful. Have realistic expectations, particularly if this is baby number 1. Ripening can take a couple of days. We allow that process to happen. We respect that that process takes a long time, particularly in a first-time mom. No one is going to be sitting here watching the clock. We allow the process to happen. It's why we use these methods, why we use them kind of in a rotating basis, whatever your body might need best at that time. And we go from there. But again, if we're starting from scratch, if you see people start pulling this stuff out and talking to you about Foley bulbs, you're not having a baby that day. You're probably having a baby within the next 48 to 72 hours, okay? So again, realistic expectations for you, for family and friends. This is what kind of happens with the induction, okay?
It can take up to 5 days.
Yeah.
That's kind of our outside range there that we have seen in our experience. But we're patient, we're midwives. We do a lot of sitting on our hands. Bring stuff to do.
Yeah. Enjoy. It's like your last moments of freedom. Bring something fun to do. Pitocin, I think this gets a bad rap. There's films and things out there now that, oh, Pitocin is terrible and horrible and don't have Pitocin. Pitocin is a synthetic version of a hormone that your body makes automatically, and your body makes oxytocin. Pitocin is the synthetic version. Yes, it brings on contractions. Yes, it brings them on strong and close together. We use our Pitocin responsibly. We use it appropriately. No one is going to slam you with contractions that are unsafe, that are not safe for baby. Our goal is a contraction every 2 to 3 minutes to progress your cervix. There is an appropriate time to start Pitocin. We're not going to get into this in this class. This is more for your childbirth class, but just know that all of these things are tools for us to help you in your labor as we induce you and as the process goes on. And all of these things are used responsibly and appropriately at the right time.
So what happens if you have to have a cesarean? Again, I get this on my birth plans all the time. I don't want to have a cesarean unless it's medically necessary. On my honor, you will not have a cesarean unless it's medically necessary. The wonderful thing about physicians and midwives is that there is no clock in labor. There is no clock, okay? As long as you are happy and healthy, as long as the baby is happy and healthy, we are very, very patient. At the hospital, 24/7, you have both a midwife and a physician. The midwives work 12-hour shifts so that you always have a fresh midwife, not one that's tired and wants to go to bed, okay? You always have a physician who most of the time stays in the background, right? If everything's happy and healthy, you may not see an MD while you're in labor and delivery. You may not. But what that means is they want to go to bed, right? They're not in the back room sharpening their knives, okay? So I promise you, if you're going to have a cesarean, it's going to be either because the baby has declared that it does not want to do labor, or that we've pushed, for 4 hours and this head has not moved one bit. There's been no progress, right? Or that you've been 9 centimeters despite us helping with all the P's of labor, positioning your pelvis, repositioning the baby, giving you more power with some Pitocin, working on your psyche, getting your pattern just right. And we've done this for hours and hours and hours, and we're not getting any result. And the baby's getting tired, and you're showing signs of infection. And then we'll say, hey, I think it might be a good idea. And you're involved in the process, right? You're involved, and it doesn't come as a surprise to you. And you're actually at the point where you're going, yeah, actually, I think this is the best call. There are emergencies in labor and delivery. They're few and far between. Most of the time, we see the writing on the wall as it's being written, right? And we have conversations throughout. If there is an emergency, I can promise you the OR's right there. We can respond. The doc is in-house. The surgeon will be there right away. We are equipped to handle an emergency should you need it. If you do need a cesarean, I promise you, you needed a cesarean. You can't say that for every practice, but I can promise you that with us. If you need a cesarean, can your posse of 5 people go with you to the OR? No, you got to pick one. Usually it's the partner. If it's not, you get to choose who it is. And then family waits in the waiting room. And then usually it's like, it takes longer to get set up than it does to get the baby out. Getting the baby out is just a matter of minutes once they start the surgery. And then they take their sweet time putting everything back together so that you can hopefully try labor again for your next pregnancy. Okay? And all of our surgeons do double closure on the uterus so that you can try for vaginal birth next time. Okay? You can breastfeed in the recovery room. You can try to do skin to skin in the operating room. We encourage the partners to wear a shirt that buttons or zips in the front so that when they put on their bunny suit, it looks like a bunny suit because it's white, you can just unzip it and the partner can do skin to skin in the OR. Usually moms are a little shaky and their arms are all you've got the blood pressure cuff, you've got the oxygen sensor, you've got the IV. So, it makes it a little bit challenging because the drape comes up right here and you've got this area to work with. Skin to skin in the OR is hard. But we can try it with a partner supporting the baby and holding the baby there. Mom's not going to be able to hold the baby there. But it's, 30 minutes or so. Then you're in recovery. And you're in recovery for 2 hours. Vaginal birth or C-section, 2 hours after birth. And then you go to your postpartum floor. Okay? You can breastfeed in the recovery. We respect that skin to skin. That golden hour starts as soon as you're in recovery. Okay? Our biggest goal, we had door number 1, spontaneous labor. We had door number 2, induction. Cesarean is definitely a door number 3 for us. But our goal is healthy mom, healthy baby. And if that's what your birth story needs to be to get that response, then that's what we'll do.
Postpartum. Everyone looks like this when they leave the hospital. So basically there is lactation support at the hospital. We encourage you to take advantage of the breastfeeding class. That's hugely helpful. It runs daily, I believe. Yes, daily with the exception of weekends, the breastfeeding class.
The breastfeeding class is every day.
Oh, fabulous, every day.
Every
So
day at 9 a.m.
Attend. People want to know.
10 a.m.
Oh, 10 a.m. Everyone wants to know how long am I going to be there? You're going to be there for 2 days following a vaginal birth and 3 for a cesarean. I always get the question, can I leave early? I don't like hospitals. They smell. I don't like the gown. I want to go home. I've heard it all. We strongly encourage you to stay in the hospital because you have extra hands in the hospital. You have nurses that are helping you learn baby care because nobody raised their hand that this was baby number 2. So you are having somebody help you with your breastfeeding. You are having somebody help you when you get up and go to the bathroom because that's not going to happen quickly the first couple times, whether it was vaginal or C-section. You are having somebody bring you your dinner on a tray. There are built-in safety nets that you have in the hospital that you do not have at home. We don't say that to insult anyone's support system, family, anything like that, but think very carefully about, I want to get out. Sometimes, not all the time, sometimes the babies that I see for lactation issues are people that were like, I got to get out of the hospital in 14 hours. I'm fine. The baby's fine. The baby's feeding. And then I see them a week later and like, the baby won't latch. I'm like, right. And maybe if we had seen some of these issues start to declare themselves in the hospital over a 2 to 3 day course, we could have intervened. Not all the time, but sometimes. So again, take advantage of that time that you have. Take advantage of the expertise of your midwives, your nurses, your physicians, your lactation consultants. Take advantage while you are in the hospital. If you have extenuating circumstances, if you're really feeling like I've got this, talk to your midwife and they can kind of talk to you about, are you a candidate to leave early? But we strongly suggest that you take full advantage. The other thing that I will say about that, please find me. All of our providers will happily talk to you if you feel like you have mastitis or an infection of the breast. They'll talk to you if you feel like you're having a lactation issue. But if you have a specific problem with latching, if you're expecting twins and you're worried about how am I going to feed 2 at once, pumping schedules, pumping when you go back to work, pumping if you're in the military, pumping if you're in law enforcement and have to wear a bulletproof vest, and how am I going to pump? I've done it all, folks. I can help you with that. So please come find me as a lactation consultant and we will figure out whatever your unique need is and however we need to kind of move through that. I will help you with that to the best of my ability. And we also put this link in here too, postpartumva.org. We don't say this last because we mean it as an afterthought, but it's kind of like the womp kind of note to end. Postpartum depression is a very, very, very real thing. I think our unique area here in Northern Virginia, we have a lot of great things that we do really, really well. But one of the things that we don't do so well is we put everyone in a pressure cooker and we work really long hours at really hard jobs and we have to keep up with the Joneses and it's hard. If you feel like you get home and you are starting to slip, I always tell my patients, if you feel like you're starting to slip and lose the joy of mothering and the joy of being a partner, and you just kind of feel like the walls are caving in and that joy is just kind of as the days go on, that's a problem and you need to find us. You need to call the office and come in. You need to go to postpartumva.org, which is an amazing website that lists therapists, social workers, psychiatrists, whoever you may need to get in your support system and to get in your network to help you. Contrary to popular belief, if you call us and say, I'm really depressed and motherhood is not what I thought it was and I really need help, our next call is not to the police. Our next call is not to social services. We're going to bring you in and we are going to help you. Please do not be afraid to reach out to us. We mean that. If you don't want to make the call because you're afraid, embarrassed, ashamed, whatever, have your partner call. We would prefer you because we like to talk to you. You're our patient. But if somebody else needs to make that call, please make it and get in and see us so that we can help you. We have resources. Not everyone needs medication. That's the other rumor I hear a lot. You're going to call the police and then you're going to put me on so many meds that I'm like just sitting in the corner drooling. No, that's not what we do. Do some women need medication? Yeah, sure, and we can prescribe that. But some women just need to hear that it's okay to not be perfect and that issues happen and that we can walk you through that and we can get you linked in with a really good counselor or a therapist. Wherever you fall on that continuum, and I hope you don't, but if you find that that's you, please call us. Don't wait. There's no such thing as a stupid question or I'm overreacting, and I'm sure every mom is like this. Just call. let us walk you through that and let us kind of help make a clinical decision. But that's so incredibly important. It's hard. Motherhood is hard. And I'm sure Stacey can attest to that. I love my children tremendously, but it's the hardest work that I have ever done. So again, please just know that that's a very real thing and that we're here to help you in any way, shape, or form that we can on the other end. We're not just here for the pregnancy and the birth. Yeah, that's the fun part. It's cute and all, but we're here for the postpartum part of the journey as well.
Absolutely.